Yes.
We do a lot of roadway cleanup in our county, and it's just crazy how many.
We're really encouraging those to be, to slow down on those things and let the qualified people do it. Especially if you've got kids, adolescents out doing community service. Too many of them out there on the roadways.
And they find,
Yeah, I
several.
heard some bad stories about that.
So I don't know, some of you may know Dr. Goddard. She's with the psychology department here at NKU. And I've had the great honor of being a student in her Psychology 101 class, and very intrigued by many of the other courses that she teaches. She's taken it onto her vast portfolio to adopt harm reduction and drug policy. So she's traveled all around the world to research and hopefully work to develop some of those programs here in Northern Kentucky. I know we're a long ways off, but with people like Dr. Goddard at the helm, we're most likely going to see some very forward-thinking, some very progressive programs very soon in this area. Without any further ado, Dr. Goddard.
Well, thank you very much for giving me a little time tonight to talk about something that really is outside of anything anybody's considering here today in the United States. But let me tell you, this time last year, I never thought we'd be talking about syringe services programs in Northern Kentucky or Ohio. I never thought I'd see them in my lifetime. I never thought we'd be talking about Good Samaritan laws. I mean, things changed really, really fast here. And I think we're at a tipping point with regard to the heroin epidemic here. So, maybe what I'm going to talk about tonight is not as far-fetched as I think it may be. In any case, I think it's useful to see what the spectrum of harm reduction is. That there are a lot of things that can be done, starting with just knowing how to recognize an overdose and how to do rescue breathing, knowing how to respond when people talk about their addiction without saying, well, shut up, you criminal, I don't want to hear about that, and start treating people as human beings. I mean, that right there is part of harm reduction. You're reducing the harm associated with drug use in a way that has the potential to help people move toward recovery, right? Well, what I'm going to talk about here for a little bit is something that really is on the cutting edge of harm reduction, and this is something called supervised injecting facilities. They're also sometimes called drug consumption rooms, depends on where you are. That's another name for the same thing. The whole idea behind these is that they started in Europe in the mid-1980s. Europe is Most countries in Europe are far more liberal than the United States. The idea of providing a bigger social safety net, the idea of, for example, universal health care, they look at us like, really? You just now have the Affordable Care Act? What up? Okay. So Europe is ahead of us in terms of thinking about reaching out to populations that are deprived, who are not getting the full benefits of society. And one of the examples of that was in the mid-1980s when it became apparent that HIV was spread in part by drug use and people sharing injecting equipment, for example. Communities in some parts of Europe stepped up and said, we've got to do something to stop the spread of this disease. That's where the syringe services programs came from. The very first needle exchange program started in the Netherlands as a result of a union of injecting drug users, the Junkie Bond, they okay, which is the junkie bond. It's literally a union, it's like a labor union, okay? It's a union of people who use drugs and people who used to use drugs. And they get together and advocate for what their needs are, okay? So this idea that Jason was talking about going to people who are still using drugs and asking them what they need, okay, that's an old idea from the roots of harm reduction. Anyway, back in the mid-1980s, one of the things that was coming up in some of these European cities was that there were big open-air drug markets. People were, drugs were illegal, they're still illegal, but there were places where large numbers of people who use drugs were congregating, and they were often buying drugs and they were also using drugs in these settings out in public. And as a result of that, I mean, that's something that, you know, the non-drug using community is like, ugh, that's so awful, I wish they wouldn't do that. Okay, you'd really rather not see it. And at the same time, they were also seeing people dropping dead in their parks and in the doorways of their buildings and in parking lots and places like that. And they said, wow, we need to do something about this. So one of the solutions was these supervised injecting facilities. There are about 100 of these worldwide today. Almost all of them, 90 plus, are in Europe. There is only one in all of North America, and that's in Vancouver, Canada. There is only one in the entire southern hemisphere, and that's in Sydney, Australia. I've been to that one, and I've got some pictures from that, so that's the one I'm going to focus on tonight. They're typically located in neighborhoods where there is already a high rate of public drug use. So these are not the kinds of things that are going to be, you know, we're not going to have one next to the buildings here at NKU. Instead, it would be if you had one here, it would be in a place where large numbers of current injecting drug users tend to congregate and tend to be out in the open. So, you know, maybe under the bridge, in the Kroger parking lot, you know, wherever large numbers of injecting drug users are found and are using publicly. These supervised injecting facilities, they serve the most marginalized people who inject drugs. Okay, you already know there's an enormous stigma associated with any drug use, but especially for the people who are using publicly. Typically, they're often homeless or insecurely housed, meaning they don't know from day to day, you know, they're crashing on people's couches and that kind of thing. They also often are without current access to healthcare services. So these are the people who don't know, for example, if they were in the US, that they're Medicaid eligible or that they have not enrolled in healthcare, they're not with the Affordable Care Act. All right, so what are the goals? The goals of the supervised injecting facilities, first and foremost, prevent overdose deaths and disability. Okay, we talk about keeping people from dying from overdoses, but there are other bad things that can happen from overdose if you don't die. For example, if oxygen gets cut off to your to your brain, then you may, you know, it's like you become a stroke victim, right? So you may be paralyzed, you may be unable to walk, you may be unable to talk, etc. So they're trying to reduce the risks associated with that. They are also trying to reduce injection-related risks by promoting safer injecting practices. So supervised injecting facilities also do a lot of the same things that needle exchanges do. Okay, so they're providing sterile injecting equipment, they're providing the, you know, sterile cooker, the tourniquet, etc. So they're trying to reduce, for example, the kinds of infections that come from unsterile injecting practices. And they're also going to be screening for injection-related illnesses and injuries. So they're going to be looking for abscesses. They're going to be screening for Hep C and HIV and things like that. So in that respect, there are a lot. The things they do are a lot like syringe exchange programs. They also want to connect with these most marginalized people, and they do that by, because I've welcomed you, I've treated you like a human, Okay, I have brought you something that you need that helps you. So when you're ready, if you're ready to say, I think I need detox, I think I need to get into drug treatment, who are you gonna call? Well, you're not gonna have to make a cold call. It's the counselor right there in the supervised injecting facility who's gonna hook you up, okay? They're ready to do that. And they also connect people with health and social services more generally. So, for example, if they were in the United States, they'd be connecting them with food stamps and with supportive housing and that kind of thing, okay? So, they also are about helping the community. So it's not just about reaching out to these people who are so deeply stigmatized, but also helping the community too. Hey, if you've got a place where people who used to inject out in the park or in the alley behind your business or in the doorway of your apartment building, now they'll go to the supervised injecting facility, that's a win-win, right? Because they're not in your face anymore. And they also reduce discarded injecting equipment. So, we're reducing the risk of needle stick injuries, just the sort of disgust factor of seeing a bunch of syringes lying around, right? All right, these facilities do have rules, okay? So it's not like, it's a big free-for-all, everybody just come on in, bring your drugs, whatever. Okay? And they actually are often run with a sort of military precision. You'll be surprised. Most of these facilities don't allow anybody under 18. They don't allow pregnant women. They require that people be local residents. Part of the why would they do that? What would be a reason for limiting them to local residents?
To attract people from other areas.
Exactly. You don't want to set up a big old magnet for every, person who uses drugs from all over. Yeah. And honestly, that's a big concern. That was initially a big concern, and often is a concern when a new one of these facilities is established, is the residents, the business owners in the neighborhood are like, oh my God, so what a terrible idea. They're going to be bringing them in from, hell's half acre. They also want to make sure that the people that they work with have an established injecting history. They don't want to set it up where, hey, you feel like trying it out. Well, I think I'm going to try it out. I'm going to do it here, with the nurse watching in case I don't do it right. Okay, no, it's like syringe services programs, the same idea. They want to see that you have track marks, for example, you are an established injector. No violence, no drug selling, no drug sharing. Okay, that's actually one of the reasons that sometimes people choose not to use these supervised injecting facilities, because many times people who are using drugs are sharing with one another, all right? They're not allowed to do that within the confines of these facilities. And they also must not assist others in injecting. So the staff of these centers don't help you with your injecting. If you can't inject yourself, these facilities are not going to be for you. Okay, now the staff may say something like, oh, don't do that in your neck. Okay, let's find a better vein somewhere, okay, that is safer and less risky, but they're not going to do it for you. They may help you find a vein, but they're not going to do the injection for you. All right, so Americans are notoriously awful at geography. All right, I'm not saying you are, but as a country, we suck at geography. All right, so I'm going to give you a map and show you where Australia is. I'll bet you couldn't find that because it's kind of out there by itself and it's not close to anything else. All right, but just in case you were, most people go, oh, Australia's down there. Right, it's down under, right? Yeah, but under what? Well, it's under the equator. Yeah, it's under Southeast Asia. And here is Australia. It's about as big as the continental United States. Okay, so it's the biggest island in the world, and the biggest city in Australia is Sydney, which is not the capital. The capital is Canberra, but Sydney it's about, gosh, maybe 15–20% of all Australians live in Greater Sydney. Okay, it's a great big spread out place, but it is by far the largest city. And that's where this supervised injecting center is that I visited. So, it's located in Sydney's red light district, okay? Did any of you know that sex work is actually not universally illegal? Yeah, I mean, you may have heard about Amsterdam, right? Okay, the literal red light district. There are many countries in the world where engaging in sex for money is not itself illegal. Australia is one of those. Now, solicitation, standing on the street saying, hey, hey sailor, that kind of thing, that's almost universally illegal, all right? But operating from a bordello, for example, is not universally illegal. And in Sydney, there is a red light district, and that it also happens to be a part of Sydney where there are a lot of drug users, a lot of social deprivation. All right, here's another thing that may blow your mind. I know it did me. This Sydney's medically supervised injecting center is not government funded. It is in fact funded and run by the Uniting Church, which is the third largest denomination in Australia. The Uniting Church was an Australian denomination that was a combination. It was when the Methodists and Presbyterians and there's one other one I can't remember. Another one of the sort of mainline religions in the United States came together because individually those churches didn't have very many people, but they united and became the third largest denomination. All right, so they actually run it. I mean, there's a reading that I sent to Jason. I think he will post for
Which
you
one?
guys. This one, the medically supervised injecting center. This is so good, and it's 6 pages long. Okay, it's totally non-painful. Really, you should read this. And you'll see a quote in here from Sister somebody, who's one of the people who runs this, and she's, sorry, I keep getting closer. Sister Noeline White, who is with the Good Shepherd Sisters and works in pastoral care. When I read her quote, I teared up. I'm sitting in my office on Tuesday afternoon. I've even been to this place, and it's like, it brought me to tears because it was that moving. Anyway, it's administered and funded by the Uniting Church, and it's also funded by confiscated proceeds from drug crimes. It opened in 2001 on a trial basis. When it was first proposed, as you might imagine, the community, the residents, the businesses, they just went, not in my backyard. They had this great big, oh, hell no. Okay, you're so not gonna put this here, all right? But it was allowed to open on a trial basis for 18 months, and it was evaluated by an independent group associated with one of the universities in Sydney to see what the initial effects of it were, not just on the clients, but also on the local community. The trial status was finally lifted in 2010. Up to that point, it was going 4 years at a time. It had literally the Australian equivalents of Congress had to authorize it for 4 years at a time. But now it has finally been approved because all the evaluations, and there have been numerous ones by numerous different groups, have uniformly been positive. So now it operates like any other health service in Australia, all right? So it's just like, St. Vincent's Hospital, which is 2 blocks away, okay? It has been evaluated multiple times. That means a lot to me because as a psychological scientist, I can get all, moved, and my human side can feel very much in favor of lots of things, but if there isn't evidence, I'm gonna have a harder time pushing for it. I loves me some data. Okay, yeah, they got a lot of data that says this facility has all kinds of positive effects. All right, so here's what you see if you go to the medically supervised injecting center. And I think these slides are gonna be posted for you guys, right?
Yeah,
So
they are.
you'll just be able to see these. It has a discrete entrance. It's just on a busy street with lots and lots of shops all along. And then in the stories above the first floor, there are often apartments, okay? So it just looks like a business. It's not secret, okay? It's not like you gotta know the secret handshake to get in or anything like that. It actually has a little, you can't really see it here, but there's a sign on the door that tells what it is. It's not hiding, but it also isn't advertising itself with big neon signs, right? It's one of those things where it's kinda a need to know basis, right? If you need it, you'll know where it is, right? But if you don't need it, it's like the room of requirement in Harry Potter, right? It's there when you require it, and otherwise you don't even notice that it's there. All right, when you first enter, you go to a reception area, and there are a couple of staff members there. And the way it works is when you're a new client, you have a little bit of paperwork to fill out. You have to do things like indicate that you have a history of injecting, that sort of stuff. They ask for a name. It does not have to be your real name, and they don't care, okay? They just want a name, and they attach to that name an identification number that you then use every time you return to that facility. What this does is it lets them track the total number of different people and the number of times each individual person comes back, but without ever collecting any information that would scare people and make them afraid, oh, what if the cops raid this place, blah, blah, blah. Now this, by the way, this entire facility operates with the full support of the local police force, okay? They know that people are going in there with illegal drugs, and they are going in there to use illegal drugs, but they have decided that it is more important to keep people from dying in alleys and public restrooms and parks than it is to stand outside and bust people when they go in for possession, all right? So you go to this reception area, you register. If you've been there before, they know you, that you just gotta tell them what your number is. And they will ask you what drug or drugs you plan to use. They do that in part to keep their statistics, so they can say, okay, we're mostly serving heroin users, or they can see the changes in drug trends. You know that drug trends go in waves. Right now it's all about heroin. 10 years from now it ain't gonna be heroin, it's gonna be something else. They're gonna know about it in Sydney first before most anybody else does. But it also helps the medical staff when you go back into the rest of the facility and you actually use the drugs. They know what to do if you overdose, right? Because if you're there with heroin, then they're prepared with Narcan. If you're there with meth, which is the big drug of the moment in Australia, then they know they have to do some other supportive measures if you overdose. All right, these are the injecting carols, and I mean, it's supposed to look sort of sterile and like not warm and fuzzy. And just on the other side of this picture is the staff station. So there's a big desk there. They have at least 3 nurses on site at all times. They also have 3 counselors on site at all times. And you don't get called back into the injecting carols until there's a place for you. They have, I think, they have 8 carols that accommodate 2 injecting drug users at once. so they can accommodate 16 people at a time. They provide you with, for example, a sterile cloth, paper cloth, but that you put down on this table, whatever size syringe you use, you can put it all here. They keep that area completely sterile. What's this?
Are your needles good?
Yeah, it's a sharps container, so as soon as you're done, you safely dispose of your injecting equipment. If you overdose, there's a resuscitation room immediately adjacent to the injecting Carol's area. And when you're finished with your injection, you don't get to sit there and enjoy your buzz in the injecting Carol. As soon as you're done injecting, you clean up your stuff and then you move into the post-injection room, which you can't see very well here, but it's actually, it's got comfortable upholstered furniture. That's where the counselors are. They have a full-time person whose job it is to refer. So they have, in addition to 2 or 3 counselors who are just moving around among the clients and talking to them and checking with them and seeing how they're doing, they have a full-time person whose job it is to make referrals if you ask, or if you need something, okay, wow, that's a really nasty abscess, we really need to get you some medical help. Let me make a call and we can get you into the wound care center at St. Vincent's Hospital. It's 2 blocks away. Yeah, they're right there to take care of what you need. Once your buzz has worn off, then you're expected to leave. One of the rules, they have a sort of informal rule. It's a formal rule that says you can't smoke there. But their observation is that when people are ready for a cigarette, they're good to go. They're stable enough. They're no longer, they're not staggering. They're able to manage their own mobility and volition enough to walk out the back. Now they actually exit through the back door into a street behind the facility, so you don't have intoxicated people walking back out through the waiting room going, yeah, that's awesome. Okay, because it is not their job to promote drug use or intoxication. That's not their goal. Their goal is to treat people like human beings, reach out to them, connect them with needed services, prevent overdose, death, and illness, and prevent the spread of infectious disease. All right, so evaluation. There's been over 10 years of evaluation now. There have been more than 4,700 overdoses. This actually comes from the reading that you'll have, and not a single death, not one, since the facility opened. They have made more than 10,000 referrals to health and social services, and about half of those were for addiction treatment. So these are people who often ultimately ask for treatment when they are treated like human beings. Discarded injecting equipment in local places decreased by about 50%. Okay. Ambulance runs, that's a big one. You'll see that in a quote from somebody who lives in the area. They're like, we used to be awake day and night with the sounds of the sirens coming and going. We don't hear those much anymore. Yeah, because they're not dying out in public. They're not dying at all because they're being resuscitated there. And no increase in crimes related to drug trafficking or consumption in the immediate vicinity of the supervised injecting facility. I mean, those are reasonable concerns. If I were a resident of that area when something like this was first proposed, I'd worry, like, hey, that there's going to be a concentration of people who use drugs here. Won't that attract more dealers? Won't that attract more negative elements? And in fact, there is no evidence that that has increased. What about worldwide? There's a reading that I also sent to Jason that I said, if I were teaching this course, I would post it as a reference in case you want to learn more. It's long, it's technical, it's about 22 pages long, it's all the science, okay? But for some of you, you want to see the science, okay, so I've given this to Jason too, and it's a survey by Potier and her colleagues, very new, and they reviewed 75 published peer-reviewed studies. Peer-reviewed studies means I have a study, I think it's pretty good, I send it to a journal, the editor of the journal sends it out to other experts who review it and decide if it's worthy of being published or not. Okay, many peer-reviewed journals, these are the sort of science magazines where these things get published, have rejection rates that range from 80 to 99%. Okay, so peer-reviewed is better than not peer-reviewed. All right, so they're reviewing 75 peer-reviewed studies, and here's what they concluded. Supervised injecting facilities. First, reach a group of people that are rarely reached by other health services and gain their trust by treating them with respect. I mean, this brings me back to Jason and his story when Lisa said, you deserve this, right? You deserve treatment. This is what these facilities are saying. Yes, you are doing something that society doesn't approve of. I don't approve of it. I wish you didn't do it, okay? I think there are all kinds of things wrong with the choices that you're making. But you are a human being and you deserve to be treated like a human being. These facilities are living that, okay? They're living at large. They decrease syringe sharing and unsafe injecting practices. People learn how to inject more safely in these facilities. They've decreased public injecting, decreased discarded syringes. They lead clients to seek treatment, including detox. The one facility that's in North America, in Vancouver, it's called Insight, INSITE. And in the same building where it is a detox facility called On-Site. Yeah, so they have Insight and On-Site in the same building. So when their clients say, wow, I've got to quit, at least for a while, we'll just walk you next to it. Okay, it's in the same building. Medication-assisted treatment, methadone, which I know Dr. Kalfas and Ashel are going to talk about in a couple of weeks. Yeah, Ashel. Vancouver, 23% of their clients stopped injecting drugs. That's a pretty big victory, considering the group that you're working with here. Okay, they stopped injecting drugs primarily because they got on methadone. Right? They got on a different medication that assists them with their recovery but doesn't get injected. They save money. Okay, there's your fiscal conservatism. Okay, yeah, absolutely, sweet. Why not? It's win-win. Okay, we save lives and money. All good. Yay. All right, because they're preventing serious infections, reversing overdoses, and they lead to fewer complaints from residents and business owners about the nuisance associated with the drug scene in that area. So, does every community need a supervised injecting facility? It depends on the nature of the local drug problem and the population of people who use drugs. I saw this facility when I was on sabbatical leave the last time. I'm on sabbatical this fall. And the last time I was on sabbatical was 2003, and I went and lived in Australia for 2 months, and I lived in Sydney, and I visited all these facilities, but I also traveled all around Australia. I went to the opposite side of Australia, to the west coast, to a city called Perth. And I met with people who were working in the drug and alcohol field in Perth. And I said, hey, why don't y'all have a supervised injecting facility? I just saw this one, it was really cool. And they said, You know, it is really cool, and that's awesome that Sydney has one, but we don't need one here because our local population of people who inject drugs are predominantly people who are employed, people who have homes, who are not in that most marginalized population. Perth did not, at that time at least, have a big problem with public injecting. They didn't have the big problem of the discarded syringes in public. Okay, their problem was reaching people who were closeted, if you will, you know, who were behind closed doors and keeping their drug use to themselves. So they didn't need a magnet like this to bring people out in the open who were already out in the open, because their people were not, that wasn't the nature of their problem. So what do you think about here? Do you think we need one?
Yes.
Do you?
Oh, yeah.
Where would you put it?
Kentucky.
Well, yeah.
Probably Pendleton County.
Yeah.
There's a problem there, like, you know, and honestly, there's a huge problem in Campbell County.
Mm.
And there's a huge problem in Ohio. We need several.
And a public problem.
Yeah.
Yeah, so, and when I asked this question, I didn't ask it with the idea that I already knew the answer. I'm really asking, you know, is it, you know, I'm thinking, you know, a mobile supervised injecting facility in the Newport Kroger parking lot. You know, that's where I put the needle exchange, you know.
That's
at
where
least
they
a
were doing
mobile
the
one.
drug exchange supposedly.
Yeah.
So.
But, yeah, so that's, the thing about this is that harm reduction, like drug treatment, like people who use drugs, they're not all the same, right? It's not a one-size-fits-all problem or solution. So just because something works one place doesn't mean it's the right solution somewhere else. But if you've never heard of something like this, it's hard to consider it, right? It's hard to even think about this as a possibility if you've never heard of such a thing. I have been teaching a course in drug policy since 1999, and I was in our main office today asking our department secretary to print that thing in color, because I can't network to the color printer because they don't let us do that. This, yeah, you know. Oh yeah, we would totally abuse that, right? So, anyway, I was asking Debbie to print that for me, and she's like, "So what are you talking about?" And I gave her the quick rundown. She goes, "I've never heard of anything like that." And it's like, well, it's not your fault you never heard of that, because this is, you know, this is something that most people have never heard of. The same way that until the last 5 years or so, I'll bet you most people in northern Kentucky had never heard of syringe exchange. You know, had never heard of that kind of thing. That's like, what? Really? So, yeah.
I'm not getting something about this,
Uh-huh.
because the only way I can relate to this
Uh-huh.
is to think that if I want to go get drunk somewhere,
Uh-huh.
I'm going to go to a hospital to get drunk. That's how I kind of see these facilities.
Right.
And I cannot see what is in it for the user
Ah,
to go to a
okay.
place like this.
Can anybody help out? What if you were a person who was homeless or nearly homeless, who was using illegal drugs and injecting them? Why would you want to go here instead of just out in the street? Yeah.
Well, one, if they were to go to the hospital, they have to report that to the law enforcement. And in the streets, I know that's here, and in the streets, there's police. You're gonna go to jail.
Right, okay. Here's one advantage to the person who chooses to use this. If you're using in the park, you're at constant risk that the police are gonna come by. Okay, that's one of the most risky times for people who inject drugs, is when they are hurried by fear of law enforcement or fear of some rival person, you know, somebody I'm having a street fight with who's gonna come up and take my drugs. I go here, I can use there without the police, without somebody else coming to beat me up for my drugs. Okay, I can take my time, I can find a vein, I can make sure I get a good shot instead of rushing and missing. If you miss a vein, you've just wasted your drugs, right? So you're not getting high, you're getting an abscess, you got all sorts of bad stuff. So those are some of the advantages. Another idea here, and this is something that's a new idea for many of us, I know it's something that I hadn't thought about when I first started learning about harm reduction. We have, at least I had, very clear ideas, wrong ideas, but very clear ideas about what people who use drugs are like. And so I thought, why on earth would I ever think that a person who uses drugs could make a healthy decision? Why would I ever bother teaching somebody who uses drugs how to do sterile injecting? Because, you know, they're just a bunch of junkies. They're just gonna go do what they do, right? They're not gonna be able to make these kinds of healthy decisions. Turns out that people who use drugs are about as good as the rest of us at making decisions about our health, which is to say, sometimes we make good decisions, sometimes we don't make such good decisions. Some of us make good decisions more often, some of us make bad decisions more often. I mean, you know, just look at the rate of smoking in Kentucky. You know, we're #1. It's just something we want to be happy about, right? Look at the rate of type 2 diabetes, right? Okay, not to say that that is entirely determined by our own choices, but they play a role, right? People who use drugs can make decisions to do things that help their health the same way that all of us can. That doesn't mean they're always going to make good decisions, but if you provide them with the tools to make good decisions, they're more likely to do it than if they don't have the tools, right? That's really interesting idea you said about the people drinking in the hospital. There's an analogous situation to this, an analogous kind of facility that I've seen in Great Britain, and I believe exist in other places. I know there's some in Canada. They're called wet centers. And they are places for people who are typically homeless street drinkers to go during the day when the night shelters are closed, where they can consume their alcohol. If you have more questions or you want to sit down one-to-one and talk about this stuff, or you have an organization that you think wants to hear about this, you know, I mean, I'm on the Rotary tour right now. I mean, I'm talking, yeah, Rotary clubs and church groups, and I talked to the Skeptic Society. That was fun.
There's one.
Yeah, there. Oh, absolutely. I talked at. It was called Cincy Science Cafe. It was awesome. It was by far the most fun.
I would have loved to have been a fly on the wall.
It was a blast. But anyway, I'm happy to talk more and also listen more. This, you know, the lecture situation doesn't give me much time to listen to you and your concerns, and